Hi friends, welcome back. This is Kara. I wanted to talk a little bit, building upon the last video, about what to do if you're experiencing signs of preterm labor. So if you are experiencing a lot of cramping, a lot of back pain, you feel like your body is trying to make a bowel movement, but you don't really have to poop, or if you experience rupture of your membranes. So that means that your water breaks and you're leaking. If there's any excess blood beyond spotting, a light spotting can be normal during a pregnancy, but if there is any heavy bleeding, if you're starting to feel rapid heartbeat, or you're starting to feel dizzy, or experiencing any changes in vision or speech, it is time to go to the hospital. It's time to call 911. It's time to have a person, if they're with you, help get you there. Or it is time to call your doula if we're in earlier stages and it's not quite that level of emergency. It's much better to have a provider say, we're going to look into this, we're going to check it out, and have it be nothing, than to have it be something and have that jeopardize your life or the life of baby. We really want to make sure that you feel taken care of and supported and you are safe. So other signs, if you have been told in your prenatal care, or if you start to feel a slow build towards labor early in your pregnancy, or if you if you start to feel symptoms that feel uncomfortable or like they are out of the normal realm for where you are at the stage of pregnancy. And this can be really confusing because oftentimes we don't always know exactly where we are at in our pregnancy. Sometimes we find out that we're pregnant very late. Sometimes it's hard to know the exact date that we became pregnant, especially, as I've mentioned in previous videos, if you did not have a regular menstrual cycle prior to getting pregnant. And sometimes that can make it very hard to date how far along you are in your pregnancy or when your due date is. If your providers, or if you feel like it is early in your pregnancy and you're experiencing labor symptoms, or you've been told to be on bed rest, I know that can be really hard. There are ways that you can take protective measures, especially if you are in the mid to late 20s of weeks of gestation. Something that NICU parents in the training I attended spoke incredibly highly to, and there's a lot of research to support, and every provider should know this if you're already seeking consultation from a provider, is to get a shot of magnesium and steroids before going into labor. So the reason being because magnesium and steroids help with lung development, lowering inflammation, and breathing on your own. And that shot will last 5 days. So if your providers have said, stay on bed rest, it looks like it's getting close, there's a strong likelihood that you could be having a baby in the next week or so. Getting those shots makes a massive difference. As always, it is your choice. You're more than welcome to ask your provider for more information. It is always up to your informed consent, like what is done to your body, or what interventions you choose to have or not have. That is something that, based on the trainings that I have attended and people who I've known and worked with, and the research has shown that can be really, really critical, because with preemie babies, some of the most critical conditions that we are looking out for is breathing and their lung development, brain bleeds, and infections. So setting baby up to have less inflammation, to be able to breathe, and to have support around these critical areas can make a massive difference in babies' long-term health outcomes. It's also really important to make sure that, you know, we access support systems that are available to us. And pregnancy can feel really, really isolating, especially if there are complications. It can feel really, really isolating experiencing substance use for some people, especially during pregnancy, because it's not always common to, one, have people that you trust and can talk to about your substance use, but also that are pregnant at the same time, and the stigma can be difficult. So I really hope that you're in the Seattle area and you can attend some of our in-person workshops that we're setting up, because we really hope to make it a community that will help us all learn and grow and connect with each other and support each other through pregnancy, parenting, and fertility journeys, but also so that there's just a level of like care and validation that is available to you all. I'm gonna make a separate video on, once you have a child in the NICU, who to expect to be there, who's at your resources and disposal. And I'm also going to make another video on what support needs and ideas you might have, and how that can be used to direct folks in your life, or if you're a person providing care to somebody with a NICU baby, how you can step in and support in a way that feels helpful, always with the consultation of that parent or family who you're intending to support. Different people need different things, and it's always good to ask what they need and be a collaborator in their care. Thank you so much for listening, and I hope that we will see you soon.